Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, February 23rd, and this is our COVID briefing. We've had 8,129 cumulative positive COVID cases in Missoula County to date, with 13 new cases since yesterday, and we've had 82 deaths associated with COVID-19 here in Missoula County. We currently have 117 active COVID-19 cases. And those active cases and their identified close contacts remain in isolation and quarantine and are being supported as needed. Our current average incidence per 100,000 people is now down to 15, which is great. The state of Montana is reporting 99,040 cumulative COVID cases, which is up 240 cases since yesterday. And there are now 1,922 active cases in the state with 85 active hospitalizations. And there have been 1,346 deaths related to COVID-19 statewide. The University of Montana has had 655 cumulative UM-associated cases since the beginning of fall semester back in August, with one new case reported since yesterday. There are currently 10 active UM-associated cases. Missoula County has now administered 25,130 doses of COVID vaccine, with 8,763 people having received both doses of vaccine. So today I'm going to talk a little bit about COVID-19 variants and COVID vaccine. There are currently 3 variants in the US that are known to the CDC. One is out of the UK, one is from South Africa, and one is from Brazil. Right now, 47 states have reported at least one of the 3 variants that has been detected in their state. The most common variant present in the US is the UK variant, with roughly 1,600 cases reported across 44 states. The South African variant has had 22 cases across 10 states, and there are 5 recorded cases of a Brazilian variant across 4 states. So here's what we know about variants. Viruses constantly change through mutation, so the emergence of variants is actually really common. With other viruses, we've seen variants emerge and disappear, and we've also seen them emerge and persist. And it's just really too early to tell which of these is going to be the case for the COVID variants that we're starting to see. Scientists are actively studying the variants that have been identified so that they can understand how these cases differ from the original COVID-19 strain. The changes to the virus could affect things like how they spread and what happens to those infected with that strain of the virus. Right now, these variants do appear to spread more quickly and more easily than the original COVID-19 strain. So far, studies suggest that antibodies generated through the Pfizer and Moderna vaccines do actually recognize these variants. So if you are able to get a vaccine, you should be protected, at least from the variants that they've found so far. This is still being closely investigated, and more studies are underway right now. So as of right now, no variants have been detected here in Montana. COVID-19 tests are being sampled at random to detect for variants, and samples from individuals who travel to places known to have variants are also tested for variants. We've been getting a lot of questions about whether there are extra steps that you can take to protect yourself from contracting a variant strain of COVID-19. And I just want to let you know that the same precautions that protect you from the original COVID-19 will continue to protect you from the variants. So you want to continue social distancing and keeping your social circles small. Wear a mask whenever you are with people that are outside of your own household, and frequently wash your hands. If a person that you know has recently traveled to an area with variants, you might reconsider visiting with them until they've stayed symptom-free for about 10 days. Okay, so that's all I have on variants today. I will definitely keep you updated as we get more information. So now let's revisit some vaccine information. Our health department public clinic does continue to operate at the Old Lucky's Market site at Southgate Mall, and we do continue to open up scheduling as vaccine becomes available. We're not quite at a point where we can have consistent scheduling, so basically as soon as we know we can open up a clinic, then we open up the scheduling for that. Sometimes it's short notice, so I just want to thank you for your patience in bearing with us on that, as it hasn't been real consistent for when we're getting vaccine. We are booking those appointments through a link on the covid19.missoula.co website and through 258 info with option number 3 for any people who do not have internet access and need some help getting scheduled for a vaccination. We want to remind everyone that anyone caught misrepresenting themselves to book a COVID vaccine appointment at our clinic will have their appointment canceled. If you've tried unsuccessfully to book an appointment, we understand that it can be really frustrating, but we just want to encourage you to keep on trying. The supply remains low and the demand remains high, which makes scheduling an appointment feel really tough. But ultimately, in the end, everyone who wants to get a vaccine will be able to get one. We don't have an estimate yet as to when the next tier will start, but the county's vaccine coordination team is working to get an estimate on that. There's just a lot of factors to consider. So we've been cautious when it comes to making an estimate on time, but when we do have one, we will let you know. Last, we want to remind everyone that your second dose of the COVID vaccine is critical for you to get the full protection that the vaccine offers. Anyone who books a first dose appointment is also committing to getting that second dose appointment 21 or 28 days later, depending on whether you get a Pfizer or Moderna vaccine. So we just want to ask that everyone make their second dose appointment a priority. You are guaranteed a second dose, but only if you show up to that second appointment. We don't reschedule appointments unless a patient is experiencing a genuine emergency, which has to be reviewed on a case-by-case basis. So that's all I have for today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click the notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook. We put lots of great COVID information on our Facebook page. That's at the Missoula City County Health Department Facebook. We also do post information about our other programs that we have available at the health department there as well. You can call 258-INFO if you're having symptoms of COVID-19 and would like to schedule a test, or if an appointment or a vaccination clinic scheduling opportunity comes open and you don't have internet access, you would call that same number, 258-INFO, and select option number 3. You can also call that number if you just have any general questions. And as always, you can check our website at missoulainfo.com. And everybody stay healthy, and I will see you again on Thursday.